Hello, everyone, and welcome back to Insured Business Service podcast. Of course, I'm with Nonso Operam, and this is our spotlight. And I'm sure that it's going to be an interesting conversation because we'll be talking about Nonso in person as well as SoSoCare, which is an insurtech startup that deals with micro insurance, especially in the health sector. Hello, Nonso. How are you today?
I'm fine. Thank you for having me today.
Fantastic. Okay, so I have read your profile. I've heard a lot of good tidings about you. Basically, I'm eager to hear your journey, but as well as other people. But I would like to know about you in person, like who is Nonso.
Wow. Okay, thank you very much for having me and most importantly for reaching out. I must thank you specifically for your commitment on insurance solutions that use technology to provide insurance for common man. My name is Nonso Porom. I'm the co-founder and growth lead of SoSoCare. I started my career in banking with Intercontinental Bank. Then after that banking, I went back to studies. Then after studies, I took up another job on communication where we are managing quality system, a contracted job on ECOWAS. Then after that, I have always have an interest in development health and poverty. So I've been working around telemedicine for a long time, and because I realized during my work, I had the opportunity to visit Geneva for a program. I met a couple of people, and then I learned about that the telemedicine cannot work without insurance. But something spectacular happened that day. While I was waiting for Uber to take me to the airport, I saw a couple of kids picking plastics by the roadside. It was a hot afternoon, and when I asked them what they were going to do with that plastic, they told me they were picking it for their mom, who is selling it to buy herbs for their sick brother. So at that point, something talked to me that I was working on telemedicine to provide access to quality healthcare, bridge the gap in healthcare for over 100 million people. But I forgot that millions of people don't have internet, and these things are luxury. Smartphone are luxury for them, and they will be disconnected in terms of digital health. So at that point, I thought of how best can we bring healthcare to the common man so they can also access healthcare. Trying to have a deeper knowledge of health insurance and how it works, I took another job at ARM for a couple of months. I specifically took that job in the informal sector of micro pension, so I can have deep understanding of how common man thinks about insurance or other services like pension. So after 6 months with ARM, I left ARM to start SoSoCare, which is a low-cost micro health insurance which allow people to pay cash or use recyclables as premium to access care across over 1,000 hospitals, which is underwritten in partnership with one of the biggest insurance companies in Nigeria, Hydra HMO.
Wow. I mean, your story is really inspiring. Having, had the opportunity to have seen those young boys at that day, I'm sure that that obviously spurred a chain reaction, which has, birthed SoSoCare. So apart from this, I know that looking at the organization's model and website, it sort of operates like an insurtech startup, especially in the health sector, right? How do you think that this would impact Nigerians? How do you think that SoSoCare would be able to increase distribution in Nigeria?
Well, we started SoSoCare with a very limited budget. Health insurance in Africa is valued at over $60 billion. And when you look at municipality wealth in Africa, it comes to nearly over $9 billion. So, but the thing is that less than 5% of African continent have health insurance, and less than 5% of waste is recycled in Africa. So the problem with insurance is that most people think it's expensive luxury. People want to afford basic things of life like food, clothing, and shelter. When you live below poverty line, you don't think of healthcare. You don't believe that this is a necessity. So although these are people that are most times pushed into poverty because they have to face out of healthcare financing. So with SoSoCare, what we try to do is to bridge that gap, and not just in financing, but to create awareness and also create more, bridge that gap in trust, because it costs you nothing to use your rubbish to access healthcare. So that way we give people alternative forms of financing their healthcare instead of cash, and help that way we are hoping, and we are constantly driving distribution in communities where we are currently still working. So what we are doing with social care is to create alternative form of healthcare financing so that millions of people can have access to quality healthcare.
But to get it correctly, apart from the fact that if I want to use recyclable products, I could also pay cash and premium, right?
Yeah.
Oh, that's okay. So that's more or less like an alternative.
Yeah, you could pay cash. Yeah, the thing is that paying cash is a huge problem. With cash payment, we have less than 5% penetration in Nigeria. Average person, lower middle class, struggling companies wouldn't want to pay cash. People who live on less than $2 a day don't even have that kind of money to pay. And these are people who are faced with high disease burden. How do you also bring them into the system to have access to quality healthcare? So what you need to do is to find a system whereby the pool can be high so that the risk will be minimal for the insurance or for the underwriters. So what you do, you have to find a system that can finance this system on the long run to ensure that more people are in the pool. So that is why we created alternative form so that people could use recyclables, plastic, paper, use car batteries, single-use plastic, sachet water packs, just about anything you could recycle. You could use it to access healthcare, because when we collect these things, we sell them, then we use the proceeds to finance the premium on the long run.
Oh, fantastic. I obviously understand that there's a market for recyclable products now.
Yes.
And of course, in promoting the global
environmental sustainability. Yeah.
Yes, which I really think that is commendable, and kudos to you and your team. So, in actually directing the affairs of social care, what has been some of the challenges that you faced in the course of, the business?
Well, we've faced a couple of challenges. We launched social care with barely $4,000, and last year when we audited our account, we've had a revenue of nearly $90,000. This is what, even though we didn't have marketing budget, our growth has been organic. And presently, we have collection points which are not owned by us, which are owned by recycling companies. We are in conversation with investors. We try to raise some significant funds to enable us deploy collection points and recycle the process. So funding has been a very big challenge for us to allow us to scale, because already we have a conversation for 75,000 people on the pipeline. But to reach more people, create awareness, because most people don't even know what we do. We need that funding in terms of marketing to help us boost awareness on the importance of health insurance. And because most people don't have insurance because they don't believe in insurance, and they've not seen who insurance has helped and how insurance work. So with good financing in terms of awareness marketing, I believe that we can do more.
Okay, yes, I think that would be what would help to create a larger scale impact, which you are absolutely correct about. So two more things, and that is for customers that are willing to buy your products and services, how exactly are they able to contact you? And also for people that are looking for funding, what processes would they have to go through in order to be able to, fund the project?
Okay, accessing social care is pretty simple. It's an insurtech. All you need to do, you simply go online, and if for a cash person that wants to make cash payment, you go online and you click the plan. The plan is about 9,500 naira, and it covers basic health care up to about 500,000 naira for 1 year, including minor surgeries and basic health care condition. But for ordinary person who can afford to pay cash, we have drop-off locations in Abia State, in Kaduna, and here in Abuja, where you could drop off your waste, and this waste can be collected, and when it's up to 250 kg, we sell it and we use the proceeds to finance your healthcare for 1 year. That's why we are looking for funding to enable us scale more, set up collection process in Lagos and in major cities as well. So our goal is to raise more funding to enable us scale, and raising for capital and raising fund is simple. You could reach us via email. You could visit our website. You find our email there. You can always shoot a mail, then we will take it up from there. Or you could find us on LinkedIn, on any social platform. Getting us is easy, or you could call our numbers on our website. All
right, thank you very much, Onso. I mean, it's been an amazing discussion with you,
and
honestly, I do wish you like the very best with social care, and that this gets to be on a larger scale, because at the end of the day, the ultimate goal is to increase our penetration index in Nigeria, and reach the larger population which is underserved. So again, thank you for what you do, and thank you for coming to our spotlight.
Thank you for having me.
We hope to have more of these conversations in the future.
Thank you very much.
Hi, and I hope you did enjoy that conversation. Quite interesting one. Do ensure that you continue to listen to our podcast and share as well with your colleagues and friends future episodes and even previous ones on Apple, Spotify, Google Podcasts, on every platform that you get your podcasts.
Right, and also don't forget to join the conversation on all of our social media platforms. We might have comments, reviews, as well as questions. Please do share on our LinkedIn page, on our Twitter page, as well as remember to follow us.